So with that, the key stats that we've been sharing with you. A reminder, Bryan has 640 licensed beds. We have 538 currently in operation, and as of last night at midnight, our overnight census was 334. So those who have been following along, and Dr. Trapp was talking about the deceleration that is occurring, that's certainly the lowest we have experienced in years, so we're preparing for this. Our easy visits, folks going into that screening related to upper respiratory illness, there have been 779 using the easy visit function, and 320 have used the COVID-19 code, which waives all fees. On testing update, Bryan has now performed 40 tests with 16 of those results pending. Of those 16, 10 are inpatients and 6 are isolating at home. Just one more thing on some questions that came up last week. You maybe heard from a national press conference that occurred over the weekend that there was an announcement that they had learned how to convert ventilator machines or convert other machinery into ventilators. I just want to let you know, hopefully to give a measure of comfort what's happening at Bryan. We converted 34 anesthesia machines over a week ago into ventilators, so your local talent is fully engaged in preparing. A little bit more on that, Bryan currently has 118 ventilators that could be used to treat COVID-19 patients. This includes the 34 converted machines I just referenced, and 4 of them are neonatal ventilators. Additional, we have converted 50 rooms for telecommunications and some other creativity. That was something there to limit exposure of caregivers. But a really cool thing that shows the creativity going on in the organization, a group of nurses came up with a concept of extending tubing. So that way you can change IV poles when you need additional verification outside of a room, thus conserving more personal protection equipment, but still getting the needed medication to isolated patients. So you have a great spirit of innovation and collaboration that is occurring within Bryan here. The last announcement I would like to make is we have suspended all volunteers here at the Medical Center. We will miss them dearly, and we're thinking of them. So anyway, that's a big change here. Staff is filling in on some of those roles. We're also receiving many inquiries for how you can help us, and we greatly appreciate them. I would like to give you this phone number. It is 402-481-3036. Call that number with your ideas, and they will let you know what needs we have. A lot of people are asking about sewing masks and surgical caps and boots and things like that. Yes, there is some need for that. We are mobilized pretty well around that. So before just dropping stuff off, please call that number, and they'll give you direction on what to do. We are still seeking and accepting donations for PAPR hoods, an N95 mask, and then face shields. So if anybody out there has access to those or knows where we should maybe turn, please call that number as well, and we'll connect you and them together to see if we can acquire those. With that, I'm going to turn it over to Eric Moss, president of the Bryan Physician Network.
My name is Eric Moss. I serve as president of the Bryan Physician Network, and I want to provide an update on our drive-through clinic operations. Beginning tomorrow, Tuesday, March 24th, we will begin our drive-through clinic. The drive-through clinic will occur at our Bryan LifePoint campus, and vehicles will be instructed to the far west side of the parking lot at Bryan LifePoint. The clinic will happen from 7 days per week from 2 p.m. to 6 p.m. Again, the clinic will run 7 days per week, Monday through Sunday, from 2 p.m. to 6 p.m. each day. The clinic will be staffed by Bryan employees, and we can accommodate up to 60 vehicles in each 4-hour daily shift. In order to be seen at the drive-through clinic, patients will need to be scheduled in advance. In order to be scheduled, a patient will receive a referral from their doctor's office or from Bryan Easy Visit. Once they receive this referral, someone from Bryan will call each patient to schedule them for the drive-through clinic appointment. If a patient arrives and has not already been scheduled, the patient will be instructed to pursue Bryan Easy Visit or a referral from their doctor's office, or they will be instructed to go to the Bryan Urgent Care, which is located on the east side of the Bryan LifePoint campus. At our Bryan drive-through clinic, we will be screening for influenza, respiratory testing, and COVID-19 testing if warranted. It is important to note that if a patient undergoes respiratory testing, they will be sent home to self-quarantine and someone will call them with the results of the test. We will only screen one patient per vehicle. If there are multiple patients in a vehicle that have been scheduled, we will assess one patient and then instruct the driver to return back to the entrance to get in line for assessing the next patient in the vehicle. We will bill patients insurance as warranted, or will work with the patient to pursue any number of Bryan's financial assistance programs. We're grateful to be able to offer this service to the community, but we do ask that our patients be patient with us as they may experience lengthy wait times in their vehicle.
Thanks, Eric. I'm John Woodrich, CEO of Bryan Medical Center, and I wanted to update you on a couple of items since last week. We have suspended doing elective surgeries and procedures at Bryan. We did that in conjunction with the other healthcare facilities in the community. This is a way for us to preserve protective equipment as well as blood supply. So the instruction is basically if you are scheduled for a procedure that you can wait up to 90 days, we'd prefer that you wait that period of time. We also are changing our visitor policy again here within the hospital. We want to assure that people understand that if you're coming to visit a patient, that it would be 2 unique visitors. What we don't want to see is 2 visitors come in and then go upstairs and then they leave and 2 other visitors come in to see that same patient. The whole goal behind this is to limit exposures to individuals and the number of traffic or amount of traffic that we have within the facility. We also have the ability now to log the individuals through our security system. So you will see, and if you've been here recently, we were stopping you right at the front door. You will actually come up towards the information desk. We will ask the same screening questions that we've asked before, which will help us determine if you can come to visit that patient or not. I also wanted to give you an update on our supplies. A lot of people have asked questions, and as Bob mentioned, the community has really stepped forward with a lot of donations. We have increased our number of PAPR hoods. We were able to purchase some reusable ones, which allows us some flexibility, whereas before we just had disposable ones. That has helped a lot. A number of people have donated N95 masks, but we continue to look for those as well. Face shields are another big item that we would like to continue to find ways of achieving more of those. And then just plain gowns that we utilize for people in isolation. So we want people to understand this is just not about potential COVID-19 patients. We have a number of patients that are in isolation that it's just typical what happens day to day. So we're trying to limit the amount of use of those supplies because everybody is anticipating this surge, and we want to make sure that we're able to take care of our community should and when that occur in our community. So we were able to acquire some additional testing supplies, which has made the difference. As we stated to you previously, we did not want to stand up this drive-through clinic if we were not able to keep it up for a relatively good period of time. We have enough supplies currently. We have promises from other vendors to continue to keep those supplies coming. We have a private lab that will be running COVID tests if we go to that stage to where a person would qualify to have a COVID test run. And we are still working for the potential of running that test in-house. We will let you know when that capability is available at Bryan. So we currently have the capability of, for running what we call our respiratory pathogen panel. We can do about 10 to 12 of those per hour. Same thing from a COVID perspective, probably right in that range. It will vary as the response from our third-party lab. They believe that they can run a good volume for us. The return of that result on the COVID is about a 2 to 3 day return. When we do the respiratory pathogen panel, we can do that in-house, and we would respond back to the patient in about a 24-hour time period.
The main thing with making masks, we are in a good shape with masks that we have community sewers making, and they have been given kits for the best available material to use. So at this point in time, we do not need people sewing outside of our kind of army of volunteers already doing that. If we do find a need for that, we will make a call out to you. Probably the biggest thing that the team is mobilizing is there are some kits for making face shields. So they are working on that, and we will put any call to the public for assistance on that on our social media channel. The numbers again are we have 640 licensed beds, 538 currently ready to be used, and our overnight census, yes, it's the lowest it's been in years, is 334. Some of that is the electives, and then some of other parts of it has just been the deceleration that Dr. Trapp has been alluding to make sure we have the ability to treat this should a surge occur. We have volunteer sewers that have done things for many years that are, one of the big things that they would make are pillows for people who had just had open heart surgery so they could grasp them and when they have to, cough and clear their chest. It's something that's been in place, and then other sewing needs for our NICU and our pediatric area. So there's an army of volunteer sewers out there, some from the craft community, some from our senior volunteers. And we distributed kits to give them some guidance, and they are busy sewing away. Again, that volunteer number will direct you to any future additional need, and also kind of the distribution and how we receive those. But right now we have enough sewers for masks.